apologies in advance that Jazmin Williams from BLKBRY is not able to join us today, but it will not be the last that we will get to hear from her. So before we resume, and I hand the mic over to Vanessa Lovejoy Guron, who is also a Perinatal Collaborative board member and from Hummingbird Indigenous Family Services. We're going to do one more raffle. I'm going to ask for help. This raffle is for $25 from Amazon. And that's right. And don't leave after the panel. We will do one more raffle for 2 more items, one of which is a full massage. We got you. Stick around, and this is going to be fun. Okay. Robin. Thank you. Oh, it is Dr. Savabi. Congratulations.
It's rigged. It's rigged.
I'm going to pass the mic to you. Thank you all.
Thanks, Jax. Yeah, we saved the massage for the end very strategically, so you got to stay. Thank you for being here. This is our wonderful panel. This conference is, bridging gaps and nurturing our families. So these 4 lovely people are doing that work. We're just gonna go through. I'd love for you all to quickly introduce yourself and your role with the organization and who you represent, and then we'll get going. Okay.
Great. Good afternoon, everybody. My name is Stephanie Sachs. I am with Rebuilding Hope Sexual Assault Center. We serve Pierce County and Kitsap County. Rebuilding Hope is a community sexual assault program. We have a 24-hour crisis line. We have legal advocacy, medical advocacy, where our advocates go out to the hospital and accompany survivors through the forensic rape exam. We have an advocate at the Child Advocacy Center. We also have a commercial sexual exploitation program that works with individuals who are experiencing sex trafficking, and education program. And I am with a therapy program. I'm a therapist. We provide therapy to clients aged 13 and up, primary and secondary victims of sexual assault and abuse throughout their lifetime. So a lot of the clients, at least 60 to 70%, are adult survivors of childhood sexual abuse who are seeking therapy now. And that is all through, we accept some private insurance, but a lot is 0 to low fee therapy to provide sexual assault specific trauma treatment. That's us.
I am Bryan Neal from the Multicultural Child Family Hope Center, and I'm here, we wear many hats when we're there, but I'm here as a father engagement facilitator and PPP provider. At Multicultural Center, we really try to be a one-stop shop from everything, from coming to get food to recovery services. We have a daycare and free preschool, so you guys come out and dance with the kids and come see everything that we have to offer the community.
Hello everybody, my name is Rosario Bautista Gonzalez, and I am the Community Outreach Specialist for PCCN and Hope Sparks Family Services. I'm also a Spanish interpreter for Family Connects, and I'm also housed at one of the diaper banks, which is at Franklin Pierce.
Hi everyone, my name is Maya Washington, and I am here today with my Being the Village hat. Being the Village is a support group, a social support group for Black mothers in Pierce County and surrounding areas. We meet once a week via Zoom and once a month in person, providing social support and building community for our Black moms.
Yeah, thank you for your introduction. So what thoughts do you all have towards building health and engaging community, particularly in the perinatal field, and in your planning and services? How do you design your program and to address those issues?
Well, I would say one of the things we do as a community advocacy-based organization is we really try to meet people not just after an assault. So obviously our focus is on sexual violence, which for pregnant or parenting individuals can be anywhere from 30 to 60% of the population, depending on different demographics, have experienced childhood sexual assault and abuse. And that can have, as we all know, mental health and physical health issues. So throughout the pregnancy and through parenting. So offering those services, it's not unusual that we may have somebody who comes into our agency when they become pregnant as a secondary victim if their child has been assaulted and is needing some support throughout that process. So we really are there regardless of when they're needing that service. And we try to engage the community in a lot of different ways. We've started engaging in more street outreach to try to serve a variety of individuals that we might not have normally reached. Also, we have a Spanish-speaking therapist that's been with us for a couple of years so that we can offer therapy in Spanish, which is another just access issue we're trying to meet.
For working with fathers, it's really important to know the resources you're sending the father to. And not just doing a warm handoff, but actually telling them, like, this is the person's name you're going to go talk to, and walking with them and making sure that you have the introduction face-to-face with them as they meet the person and make sure that they feel comfortable. A lot of times, even, speaking from experience, a lot of times, even when you walk around with a preschool child, an elementary school child, or especially a baby, a lot of people think that something's wrong and that you shouldn't be the one there. When I first signed my son up for elementary school, they kept asking me, where's the mom, or asking me about that. Well, I'm the parent that's here, and I'm the parent that's gonna be here for, the mom's not gonna be around, but it just feels wrong to a lot of people inside society. So just making sure that you really make sure that the dad feels comfortable and that the person that you're working with isn't gonna judge the father or expect something else from the father. So making sure that everybody's comfortable in the situation.
And for us, Family Connects is there since the baby is born all the way to first 12 weeks of life of the baby. And even though we say 12 weeks, we still continue to be there for the mom and the baby all the way until they want to come back. Like I said, we're the diaper bank too, so we continue that relationship. But we do outreach, and we're also at the hospital doing roundings, which is St. Joe's and Tacoma General. We're there. We tell them about our program. We do it in Spanish as well too, and any other language that we're able to have an interpreter or find a way to have an interpreter. We let them know what's the program about. We show them videos that we just created recently of families that actually did the program and the benefits of being and doing this program and being there with them. And we've seen they continue to be with us even until now. Since the program's 3 years old, and we still know a lot of these little babies that are now turning 2 or 3. So we're there, we send them all the resources that they are asking us, and we continue to build other programs or other relationships with other communities to keep providing the resources that they need.
In Being the Village, we acknowledge that Blackness is not a monolith, but we do have a lot of shared values in our culture. And historically, throughout the generations, we've thrived on this sense of community and having those who are plugged in their niche areas and having the resources and bringing them back for the shared knowledge, and then having that word of mouth of this is a safe and trusted partner. And so we really do a lot of our planning. Chelsea is our founder. She and I spend a lot of time building our community partners and scoping things out, so when we bring it to the group, it's coming from a trusted source. And so we're working with health providers, with different community agencies who provide different supports. So we're saying that this is a trusted place to get that information. Or if we're seeing families with specific needs, we're saying, okay, well, we know these people that we met at places like this, and we trust them. And so we want to know how you're experienced with, and if we have to cross them off the list, we'll cross them off the list. And we'll do protective things where people will say, oh, we want to come and talk to your group, and we'll say, you know, we want to keep this our space. And so what are the goals and the outcomes you need? And maybe we can partner in those ways, but really keeping it a trusted space for our families.
Yeah, I like that, Maya. Like, we're keeping track. No, it's true. So just to build on that, what trends are you all noticing among the families you support? Thinking about the people here in the room, you know, what is something you want to make sure they all know as, you know, as far as barriers and issues that that the families you serve are facing?
I'm sure you've heard it before, but believe Black women. That's what I want everyone to know. When we tell you we're in pain, we're in pain. We wouldn't say anything if it wasn't that big of a deal. Sometimes when it really is a big of a deal, we still won't say anything. So if we say something, that's the alarm. I know they do that for farmers too in some places. Like if the farmer comes, it's a really big deal. If we show up, it's for real, believe us. And that's just what we're pushing of when we have parents in our space who are pregnant or have, you know, small children, and they're saying this is a concern, you know, we're all joining together to push that message of go see your provider, go check in with your provider. Oh, I'm tired, but you know, if no one's gonna do it, I'll do it. No, you don't have to do it. You don't have to do it, and we'll find someone who will do it for you. Funny story, we just had someone who's in their first 3 months of postpartum, and she was like, I'm gonna take the big kids out on an outing. And we were like, no. But I'm gonna be there, so if you're there, I'm gonna be there. And she found me and she said, I should have listened. And all the other people that were there too were like, you should have listened. And so we know for the next time, she was telling everybody, if Doula Maya, because I have a doula hat too, if Doula Maya says sit down, you should probably sit down. So.
What I've been hearing is like the mental health service, the therapy, the counseling in your language, in your culture. That's something that moms have expressed to us when we do a group or something. They're like, we know that we want this, but we can't find somebody that relates to us in our culture or even in our language, you know, because even like Bryan and I were talking about this recently, about language, even if you speak Spanish, but they're from Guatemala, Honduras, and you're from Mexico, that doesn't necessarily mean we're speaking the same Spanish, it's different. So trying to find providers, somewhere or a place where you're gonna go and they're gonna understand you. I had a mom that shared with me recently on Friday, they're like, yeah, after I gave birth, postpartum depression was showing up. I had a telehealth call and I had an interpreter on the phone. It just did not feel the same. I felt like it was just repetitive questions after the same questions. They were like, I stopped it. I was like, well, I'm not getting the help that I need. I still feel the same way. And I was like, yes, I totally understand you. And luckily that day we had a presenter that speaks Spanish and is a therapist. They made that connection. So we were super happy that we could help her. But that's a number one thing, is always finding somebody that speaks your language, that can connect with you and your culture. And so we're hoping to connect with more therapists. So when I heard about you, I was like, oh, I'm gonna connect with you. I can share that with my families too. So.
Hurt people. So really making sure that us that are providing the services, that we checking on our mental health and you're checking on your coworkers' mental health. And also that male mental health is something that just over the years has been okay in society to talk about, or okay for ourselves to talk about. There's a gentleman inside of that takes one of our classes, and he got comfortable with me and started calling me. I just need to talk. And by the time we finished the conversations, he'd always end up inside of tears because he didn't have anywhere to express, and he just had so much built up. And then he finally got comfortable enough that he started going to talk to somebody every month. Greater Lakes has been really great about getting people that we've sent over there that walked in the door to set them up with appointments so that every week they could go in there and talk to somebody, and that they don't just have to stick with this one person, but they can figure out who they feel comfortable with. Private insurances, they do all the time. They let you go to this counselor, that counselor to figure out who you feel comfortable with. But knowing that you can send somebody to somewhere where they can feel comfortable and that they can let everything out, because if they're out there hurting, they're going to hurt somebody else.
I think I'd just say two things. One is, I mentioned just the prevalence of sexual assault, but it's something that, I don't know how many of you know, our agency's been in Pierce County for 50 years, but most people do not know that we have existed that long until somebody needs our help. So I just say, in all of our communities, sexual assault is not something that is often talked about or discussed. There can be a lot of shame around coming forward with that. So I just would reach out to anyone, would love to chat with anyone. Our agency staff and volunteers have probably tripled in the last few years. So what is nice about that, what is vital about that, is we are much better able to serve the whole community. We have always said our goal is to serve all of Pierce County, all survivors of sexual assault and abuse. But what that looked like was very different when our staff looked almost totally like me, to be perfectly honest. And so the fact that we have staff that so much better represent the community and connect not only with organizations but the clients we're serving, I think has done a huge amount to shift the demographic of who we're able to serve, to better represent survivors in our community, because we know that Black, Indigenous, people of color tend to experience sexual violence and interpersonal violence at a much higher level. So I think making those connections, as you said, Bryan, to be able to do those warm handoffs instead of just calling the crisis line, to be able to reach out, have a Zoom call, come into the office so that people can really see who they're connecting with and get to know them is really helpful.
All right. So given all of that, like this is what we're seeing, I would love to hear, I'm sure the rest of the conference would love to hear any success stories that you'd like to share with us, when any partnership that you've created, any referrals you've created, or just in general, like the family stories from your families that you serve that kind of let us know we are doing something right. We might not be doing everything right, but we are doing something right. Do you want to start, Bryan?
I think a good success story is that it's taken 12 weeks to graduate from father engagement. There's a dad that had been there for over 200 classes, and he just kept coming and coming and coming, and he said, I just want to be here because there might be something that I say or some experience that I have that I could tell somebody behind me that will help them get through it. So seeing somebody that is so focused on that he's giving up his free time every week to come help somebody else that he doesn't even know, or somebody else that might not ever come, but he's just there because he wants to be there to help somebody. So seeing things like that really gives faith in the community that people care and they want to help somebody.
So for me, I would say, like, we have different groups, and with PCCN, we have Voces de Familia, and we created about almost 2 years. And something that we've noticed with the families that we have there, slowly they're engaging in other events that we have in the community. Like, we have on Friday, there's going to be family night with Pediatric Northwest they're creating, and they're attending these and they're participating and they're wanting to do more. And like, if we have other events, like Amara has so many events, we tell them about it and they go and they say, how did you hear about it? Oh, you know, we heard it with Rosario, Voces de Familia, or whoever they heard it from. And so they're continuing to grow more because they do want this information. Sometimes they just need to be directed to which point, where to go. And I see their involvement with the community and giving their input, and we're starting to hear more about what they want, what the changes they want to see. So it's really nice. And another thing is, with Family Connects, we've had families that had their first baby, and it was during the pandemic, so we only did telehealth calls. And now they're having their second baby, and we go back and offer the program, and they're like, yes, and definitely come to my house. And they're so kind of warm, and it's so nice to just see that growth and that connection that we're continuing to build with them, and just, yeah.
For Being the Village, one of our major messages we push is the impacts of isolation on maternal health. And I would say our biggest success is when we see the relationships extending our program time, when we're seeing people who met at group celebrating their 1-year bestie anniversary because they both had twins, and their twins are different ages, but they just became best friends. And we're celebrating all these milestones because it's extended past that hour and a half of time we have together every week. And the village is really being built to where, you know, as the families are growing, we're building these trust systems, and now the dads want to hang out, and like, which is expanding the way that we had hoped to, so.
The main thing that I see is people engaging at different times. So in our case management program, with our sex trafficking program, folks may come in and out at various points, and the case manager is there for them regardless of when that happens. If they go for a while and then don't come back in and then come back in, it's seen as a success to be able to be there when the client needs us. The other thing I'll just make a pitch for is that PTSD is treatable. I was having a discussion with somebody just a little bit ago here, and that idea that once someone has experienced trauma, or they meet criteria for PTSD, or their child is assaulted and they are being triggered by things that are happening in their home, and that multi-generational abuse, I think one of the things I appreciate the most is when we can see maybe a teen who's been sexually abused in their family work through the PTSD that's keeping them from going to school, or the conflict with their parent, and the parent as well, to be able to see them and have them really strengthen that relationship with their child and work through their own past issues. So that's a success for us.
Yeah, so I'm hearing about not feeling isolated. I'm hearing about not feeling alone. And I'm also hearing about how these communities, how you all are building these communities where they're actually taking care of each other, right? You know you've done your job when you model that behavior and you look, and there's success stories left and right. So thank you for hearing that, because all we hear is, you know, all the statistics we've been hearing all day, right? So I think it's important we highlight that. So switching a little bit, so those of us who work in nonprofit, direct service, community-based health, we all know we could always use more money. You know, I was going to start here. No mystery. So what would you do, or what do you say to funders and stakeholders when it comes to contributing towards tangible changes in our community, particularly to improve maternal and health outcomes, maternal and child health outcomes?
I think this one I would say non-restricted funds. If we can get non-restricted funds where we can just buy what families need, like formula that sometimes WIC, they do get WIC, but it's just not enough, and sometimes babies have certain specific formula, and then we have families that call us at the diaper bank and be like, I'm looking for this one, and you're like, I don't have that one, I have this, but let me look around. So, or other concrete goods as pack and play, or even more diapers. Sometimes they have more than one kid, so it even makes it more difficult. So it would be nice to just have non-restricted funds. And also to trust the families, what they're doing with those funds, you know, so because sometimes they ask for more information after that, and you're like, oh, I need this and this to report it, but it's like, just trust them, you know, they need it, that's why they're here and they're asking for it.
I agree. Unrestricted funds. What we do with Being the Village is I think it's hard to fit into a lot of the grants that are being offered. We're meeting a lot of the deliverables, but tracking it makes it really challenging, because how do you do the data? Because we got together and had a meal. Where would we fit those things in? How do you measure those things, like connected with other people in the community, which shifted into beautiful things. They matter, they need funds, but I think it's really hard to track, and just understanding that there's different ways to achieve a lot of these greater things that we're seeing the numbers, and we believe that we can change these things just by getting together with our children or not our children and hanging out while they run around. That's what it looks like, but there's so much more happening under the surface.
I think one of the things we see the most is that the well-being of our staff impacts the clients that we're serving. So there's an unlimited need for help and assistance, but that doesn't mean that there's unlimited resources. And so when agencies are asked to do more and more and more with less and less, and their staff are not paid adequate wages, at a certain point, we have to kind of say, we may have to, and we've had to do this internally, to do some salary equity stuff where our managers were making a lot of money who'd been there a while, maybe the frontline staff weren't, and saying, okay, no management's getting any increase until the frontline staff are up to a living wage. And then saying to the funders, the outputs might be less because we need to make sure that our staff are maintained without constant turnover and burnout and caseloads that are too high. Because I think just recognizing that how well our staff are is how well they can serve clients. And so maintaining staff health and wellness has a direct impact on the missions of our organizations and also how well our clients are served.
Data is expensive. We were just talking about Apricot. Apricot's like $28,000 a year. It's crazy. And that's another staff member that you could be having out, helping people. So we really noticed that the private dollars go further in the community than the governmental dollars. The governmental dollars, you have to attach data to it, you have to have somebody giving time to it. So a bus driver signs up to drive a bus. They don't sign up to clean the bus. Counselors are signing up because they want to teach classes, they want to do direct services. They don't want to be, I hate Excel, but they don't want to be on Excel doing data. So those unrestricted funds, like you were saying, it just gets in the community further, it helps our community further, and it helps bridging gaps better.
Yeah, all of you made such a great point. One of those things that, personally is like we trust the people with their own health. We believe them, right? Like we believe you need this car seat. I don't want to have you prove that, right? Over and over, we see kind of that the spirit breaking of a lot of the services we serve, and that contributes to their health. That contributes to their children's health. And so I love all the points you all made, and I appreciate how you're all doing this for community. So what time are we? 4:28. What is it? 4:40ish. All right. Yes. So finally, is the final question. I was at a Black Maternal Health Conference not that long ago, and there's Quajalyn Jackson, who's the executive director of the Feminist Women's Health Center in Georgia. Incredible speaker. She said this, and I wrote it down. Rage is the lighter fluid, but hope is the fire, right? Like we're all here doing really hard work, and a lot of us are very tired, like somebody was saying earlier. So I want to see, how do we keep doing this? How do you all keep doing this? How do you all, it's something that we don't talk about enough, because it was just like grind, serve as many people as we can, even though we really can't, right? So my question is, how do you stay inspired? How do you keep going? And hopefully that'll be a good way to close this panel. And I'll have you start, Stephanie.
Thank you. So working in a sexual assault center, people will often say, oh my gosh, how can you do this work? I bet you guys get that all the time too. We all do with our work. Oh my gosh, how can you do this work? That must be so hard. That must be so difficult. That must be so depressing. And at the agency I'm at, we'll often kind of joke because it's actually a really fun, enjoyable environment. And even not just amongst the coworkers, but when I'm sitting with a client, yeah, there is darkness and there is suffering and there are really horrible things that they've been through. And there is laughter and light and joy and connection. And I think, I know for myself personally, I get to witness both of those, not either or, but and, all the time. And I get to just be reminded that even in that darkness, there is laughter and connection. And so for me, in each moment that I'm with a client, that's a gift that I get, that I receive from clients that I am able to work with, and that keeps me engaged and hopeful.
I think seeing families change. So seeing families get back to their families out of foster care. Seeing kids who are homeless get housing and be excited about having the housing. There was one family and they were staying inside one of our tiny homes and they said, "That's my house." Seeing things like that just give you so much hope and push you to help the next family. Seeing kids who have graduated that are coming back to come see their preschool teachers to take pictures with them. Just seeing the changes that you break in what was going on with them and put them back on the path that they want to be on.
For me, I truly really love what I do. Every day I wake up and it doesn't feel like I'm going, it's not a job. I love what I do. I love interacting with the families, and I feel like I have a unique position where I can work with different organizations or belong to different organizations, but our main goal is to help families. And when I get to be with those families, with those babies, and see them come back for our services or ask us, have that personal interaction, is warming for my heart, because I feel like in a way they're almost helping me be more expressive of my feelings and just be open with them and share my stories and help them be more connected and be like, this, I can trust this person because they know what it is to come to a new country and speak a different language. They know about immigration, and I don't have to feel like I can't share with them about immigration because they won't understand me. Or about DACA, deferred action. I can identify with you because I've somehow been there or I've had family, so I want to be there for them, and it feels good to just be able to work with all the families I've been working with, and I hope I can continue to help more families.
The village concept, model, lifestyle, I was so blessed and privileged to be raised in it, and so I know just how important it was to have other people that I could go to when my mom may not have had the capacity at that time. So showing up and just giving that, for the next generations to come, it just is who I am. And so, yes, it's exhausting, but it's an extension of me. I came to being the village as a parent with a 3-month-old, and I didn't even bring him to group. I just would come and sit and watch everybody and cry. And now I get to do that with everyone else, and we're doing it together. So it is me. We are that.
Well, and I'll just point out that I really love what you said, Maya, about how do you measure these success stories beyond just like qualitative data. And I think policy people, if you're all in here, it does translate. There is data somewhere, CDC is hiding it. There is data out there that shows what we're doing does translate into, childhood readiness, kindergarten. What we're doing is reducing, mortality and morbidity in our pregnant people. So I always have to put a plug. There has to be some more research or more studies or something to show people like this is how we're impacting health in our communities. And so I'm going to open this up for Q&A. These are awesome people, and I want you all to meet and ask questions, and there's time after our final raffle. I encourage you all to come up and talk to them, talk to other people. So are there any questions out? Is Chris out there? So she will be making her rounds. So for anyone on the panel.
Hello, my question is for Bryan, but for the rest of the group. My name's Jose and I work for the WIC department. But my question is, in your experience interacting with young dads, what do you feel is the best way to support a young dad during the postpartum period?
It's funny because during COVID, I had to call the WIC office. During COVID, I had to call the WIC office because there was a dad who needed WIC, but he was uncomfortable going there. So I talked to somebody over the phone, and we ended up getting him helped out. But I think just in healthcare or just around the beginning stages of life that everybody's just so used to the mother being there. Sometimes you see the mother and the father, but very rarely you see just the father. And that makes, I want to say uncomfortable, but it makes people feel uncomfortable, and they shouldn't be there. So a lot of times when you see dads with a baby, even inside of stores or just walking around in society, like, it just feels weird just to see the dad there. So a lot of dads are uncomfortable in many different situations, but yeah, especially when they need help and they don't know where to go to get the help, they don't know how to ask for the help, and I don't think that they should be there to get the help as well. So.
Anyone else want to?
Good afternoon. My name is Adrienne Christina, and I'm a family voluntary services social worker with DCYF. So I have two questions. One, are our clients, do they self-refer to you, or is there a referral process through my agency to you? Particularly, I'm looking at for Stephanie to help support our young ladies.
Yeah, so for the most part, we want the clients to reach out to us, but what's really nice is if somebody is already working with someone in the community, and we can do a much more direct, warm handoff. So it could be calling the line, it could be calling me directly, it could be calling another staff person. I think some of the best experiences I've had is when we've set up something to just do a 10-minute Q&A, get to know, here's what happens beforehand. So either way, so it could go through the crisis line, which has how most of it is self-referred, just because we want the client to feel like it's their choice and they can engage or not engage, just because that choice can be taken away from them during the assault. But we also want them to feel safe and supported in coming to us. So either of those ways are fine. Or with the release of information, we're pretty boundaried around that, just because we do want the client to know that we take their information and the things they choose to share with us seriously, and we're not going to share them without really explicit permission from them to do so. So sometimes, to be honest, it can be seen as a little rigid, because it's like, the client said I could talk to you, I'm going to talk to you. But with those things, then yeah, we're really happy to do a back and forth. Yeah.
And do you connect with law enforcement or the courts?
Yeah, so the clients do not have to have reported for adults, so we are mandated reporters. So if it is someone under the age of 18 and they disclose enough information to us, we are mandated reporters, which we let folks know. We are on the back of the incident card that you will get from like Tacoma Police, Pierce County Sheriff as a crisis. Our advocates also go out to all the area hospitals if someone is raped, and they do go to the hospital and accompany them or their family through the forensic rape exam. So while we will get reports or referrals from law enforcement or hospitals, the vast majority of sexual assault victims never report and often don't disclose. So it may be a family member, a roommate, a friend. And the nice thing about a community-based advocacy is regardless of whether or not the person reports, regardless of whether or not it's picked up by CPS, regardless of whether or not it's charged or convicted, the client can receive services. We can help them fill out protection orders, all those things, even if they choose not to report.
And for Maya, I was wondering, could you share a little bit more about your doula role?
You knew that was going to come. Yes.
Yeah. Do you have any specific questions?
That's how awesome you are.
Do you work with our clients, or is this private, kind of insurance? Do you have state insurance?
Doula Maya is very, very restricted these days. So sorry. It's running joke. I have 7 jobs.
You opened it up. You
My
started
main
it.
job is, shout out to First Fundamentals. When I was an active doula, I had a private practice called Nurture by Nature Family Support Services. And I am currently and still contracted as an open arms doula. But right now I'm taking I've had 3 births this year, so it's very slow. I have a client, I'm on call right now. Yes, so I serve people who want a doula. And if I have the capacity, it's a yes. There's all these new rules. I'm so glad Medicaid is a doula thing now, but I'm kind of old school. And I just want to show up however I can.
Oh, I just want to add too, we had a gentleman that came and he did Triple P and FSP, I think it was called. But he told our dads one night about all the services they could get if you self-report. So that night, 2 dads called and self-reported, and they got all these different services, and they're so happy. So that's cool.
It's Erin. My question is for Bryan. And if this is too personal, just defer in a different answer. So I'm a midwife, right? And I am very focused on my moms and the fetus. And I struggle very much to bring the dad in other than inviting them and thanking them for coming every visit. What do you have as a suggestion for me to engage or would make them feel more comfortable?
I think just making sure that they know that they're important, and just tell them you're important, your voice is important, and maybe even ask them, if they have something to ask or something to tell you or anything like that. Just giving them the space to be open and that they know that they're part of this too goes a long way. So, appreciate that. Yeah.
So, for hospital-based providers, there is, I work for, I run a doula program, and we see a lot of anti-Blackness in hospital rooms, right? So you have a dad who has darker skin, and he may not feel comfortable, or their partner, the laboring person, they want them in the room, right? And so somebody, as Dr. Savanti, interrupt that complicity, that if you hear a nurse or if you hear a doctor say something, you're like, oh, Dad, I'm so glad, just kind of sideways interrupt that. So I think that goes a long way.
Hi, Bryan. This question's for you.
Bryan's popular.
Bryan's popular. My name is Sarah, and I'm from the Birthing and Birth Center in Tacoma, and we do, focus a lot on postpartum for the moms, and we do have the postpartum social group for everybody in the community, that sort of thing. But do you have other resources or groups that you know of for dads postpartum or to connect with in the community that we can refer to?
It was actually, when I was talking earlier about one of the dads that started getting help from, what's the name of it now? But it was his significant other that was going through postpartum. And he would call me and say, postpartum is so much fun. And then he'd tell me about what was going on. I'll give you the information for the place where I sent him to go to, just because he was trying to talk her into going to get help, but she was totally against it. So he finally ended up getting her to get help, and ended up being that she needed to go into some recovery services also. So that helped her start getting help, but he was going through it. So
Yeah.
I'll give you that information.
Okay, but in terms of the dads like connecting together, do you have something like that where you are, or just?
It was individual. The counseling that he went to was individual, and they really helped him talk her into going to get help. But I haven't seen anything where it's been like a fathers group that have gone together. But I think that would be something that would definitely help.
Well, I just know about Dad's group. There's that. I'm not quite familiar exactly everything they do, but I know they do group settings and all different type dad situations come there. I can share the information, but that's it. I don't have them.
I also want to give a shout out to Jazmin from BLKBRY. I know they were doing something with dads too, so you might want to reach out.
Okay, thank you.
Bryan, you should start a group.
Yes.
Bryan, Jose, help. Yeah.
We'll give Bryan more work.
Give Bryan vacation.
And it did look like Jazmin's group BLKBRY, that I think it was when we met the other day, she was mentioning having a doula for dads, a dad doula. So I don't know fully the extent of the services there, but it seemed like there was some pretty good things happening. So.
All right, any other questions? Comments? 4:46, oh my gosh, we're just like perfect timing. All righty, well, thank you for your time, and I encourage you all to talk to these awesome pillars of the community doing really amazing work. Thank you for your time and sharing.